Hello, this is Holland at the Oxford Pain Clinic. Today I'd like to talk to you about scar tissue. Scar tissue is the term that we give to a lump in a place where there isn't supposed to be a lump. And it's caused by either sudden overextending of a muscle or by heavy bruising. And sometimes it's present in the centre of the muscle, especially where there's been a bruise or a rupturing of a certain number of muscle fibres. But usually it's actually present at the ends of a muscle. So for example, if we're talking about the forearm here, the ends would be fingers, myself in the camera range, or indeed near the elbow where this finger muscle is attached. The middle finger muscle is attached. So the reason I'm telling you this is because the lump is where the damage has occurred and the blood leaks out of the broken tiny blood vessels of the capillaries into the surrounding skin, but also the lymph, which would normally drain away, which comes from the blood at the point where the blood vessels get very tiny indeed. The lymph separates from the blood at this point, and it's designed to drain back into the lymph ducts and back into the body and into the blood vessels to be cleaned and redistributed. But when there is a bruising, when there is damage, the lymph cannot drain away because the ducts and the tiny vessels are broken, so it stays in place. Now, if you are able to rub at the time, depending on how much damage you've done and how painful it is, you can redistribute this lymph at the time, which is a marvellous thing to do if you think of it. But obviously most people don't, and a lot of the time people don't realise that they've done the damage. So they're not able to attend to it, and quite often the damage is around the back. So they may not see the bruise, they may think, gosh, that hurts, they may rub it a bit, and then they forget about it. And then years down the line, what happens is the lymph hardens. It can't drain away when it's solidified, even when it's just begun to solidify, and if the blood vessels are broken around it, and it's solidifying at the time, it then never drains away. It becomes harder. I used to liken it to custard, which hardens as it cools and then gets really quite tough, a bit like leather. And then a patient said the other day, oh, like chewing gum. And I thought, actually, yes, that's a better description, because you may have noticed how very difficult it is to remove chewing gum once it's been there for a while. But anyway, within the body, what you can do is you can then break the scar tissue down by rubbing it usually against the very bone where the bruising occurred or the damage has occurred, so that you can break down the hardened tissue into small pieces which will then be carried away. And in doing so, what you do is you liberate the blood flow and you allow the repair to happen, so the muscle will regain strength and then flexibility and contractibility, which is what we needed to do. I hope that's a good description that helps you to understand what scar tissue is, because that's quite a lot of my work is involving breaking down scar tissue so that people are then able to move again, and as you break it down, the pain dissipates and you become more comfortable. So I hope you found this video informative, and I shall be making some more. Look out for them. Thank you for watching. Bye-bye.